Basic Concepts of Pressure Injury Care by Susan Hamilton.
So you can see this patient's wound is on his coccyx area or sacrum, just at the base of the buttocks. This is a common area for older children to get a wound, especially if they are bedbound or chair fast and unable to move themselves. Just wet normal saline gauze is good for cleaning wounds. You want to use some pressure to clean off any dry skin or areas that are just dead and dry and flaky. You want to clean the wound bed. If it bleeds a little, that's actually a good sign that there's healthy, viable tissue there. If you push too hard on the wound, though, you may actually disrupt the wound bed. So you want to use some pressure, but not aggressive pressure in cleaning the wound. Once the wound is all clean, you can go ahead and dry the areas. You want to do whatever you can to protect the skin that surrounds the wound. There are products that you can use, but also just use a dressing that will contain as much of the drainage as possible. For this wound, I'm going to choose for now a moist gauze covered with a dry gauze, and then we'll use a foam dressing to help absorb some of the drainage. The goal for this wound would be to get that slough and that eschar to come out of the wound so that then we can see what the base of the wound looks like and then get it to heal from the inside out. So now that I've cleaned it, I'm going to take a piece of damp gauze. And again, like I said earlier, if you fluff the gauze onto the wound, then I'm going to place a dry gauze over that. And then I'll put the foam dressing over for extra protection, insulation, and padding. And then I would tape the whole dressing. And I would change that dressing at least once a day, or if it became soiled with stool, or if the drainage came through to the foam dressing.